a lot of time people are getting scared. Why? Means if 22 or 23-year-old person is dying, what is the next? Who is going? How to get investigated? And the second approach, what I was discussing regarding the diagnostic evaluation and angiography, calcium scoring. Whenever the heart disease started, these are the two important evaluations will be coming. When you are taking non-vegetarian food, there is what you call there is a components which later on get metabolized and they form TMAO. So trimethylene amine oxide. This is formed, and this is one of the notorious molecule we can say that is still in the circulation and which is responsible for all the inflammation. And nowadays there is a changing, if you have seen in your family or not, anybody who's going for dental procedure, after that, within 1 or 2 weeks, you will be getting some news that there's something has happened, either heart attack or something related to the cardiac problems. And the root is, recently we were not knowing that how much important the gut bacteria and the oral bacteria.
As we hear more and more cases and instances where the heart health is becoming such a issue wherein people just like drop dead, right? And it is like this vital organ which we feel, the heart aches and the heart breaks are very common. So now we will go a little deeper. So Sunday Evening Talks is a weekly program at Shanti Sarovar, and it has been running since many years. And Shanti Sarovar itself is an oasis of peace at the center of the financial district, the high-tech city, the hub of heart, the heart of Hyderabad currently, and it provides that much needed respite from the hustle and bustle of our daily lives. It provides that peace, provides that drop of spirituality which we need or miss in our daily lives. Self-transformation for world transformation. And self-transformation is something we will learn today about how to make our heart healthy. So our guide to healthy heart, providing us the guide to healthy heart would be our esteemed guest, an expert, senior consultant in cardiology and electrophysiology, Dr. Ashutosh Kumar. Let us welcome him on stage with a very warm and hearty welcome. Applause, please. In brief, I'll give a small introduction. Brother, you can come. So he is a senior consultant at the Care Hospitals, and his journey into this space as a physician has been a very global journey. He did his MBBS in Muzaffarpur. Thereafter, he did his MD in general medicine from the esteemed BHU. Further doing his specializations from the Kolkata Post-Graduation Research Institute. And once I was reading the profile, he has trained and qualified from Kuala Lumpur, from Munich, from Taiwan. So we know his experience will lead us to the right guide to a healthy heart. So we are in the right hands to be cared for the heart. So a warm welcome to brother to lead us to a healthy life with a healthy heart. Thank you.
Thank you for the nice word of introduction, and it is a great privilege for me for presentation at this forum where people have left the Sunday and they are coming for knowing something about the heart diseases. Diseases, everybody want to just fight it, but fighting with the right tool is the need of the time, and that right tool probably I will be able to touch most of the points. And as it is a part of our foundation, our Dil Dhadakne Do, we have taken this word and this tagline because our mission is that nobody should get scared in the present scenario. The way the medical science is growing and the way the commercialization is happening, everybody is having their own way of thought and business model, which is not, I feel, health and education. These are the two pillars, should never be capitalized in any way. But due to the growing, economy, and this economy is going to touch these two fields, and that's why it is very much, I should not use the word corrupted, but it is more commercialized nowadays. And we are not knowing in this information age, when we are having a lot of information, either through the Google or through the, Chat GPT, you can get each and every information. But there is one thing, what we call as a Gyan, and second called Vigyan. Gyan is something which everybody can get in present time. It is democratized, means you can get all the information related to your heart, related to your kidney, related to the eyes, whatever disease is there. But when it comes for Vigyan, means the experience, there the difference between an experienced doctor versus the person who has just read the knowledge through the Google makes a difference. And that's why if you are totally trading by the pathway of knowledge through the Google or the Google information, informatics or matrix, the way it has been nowadays channelized, that it is leading to the, what you call it, diagnostics, investigation, treatment, and mistreatments also, a lot of time. A lot of time people are getting scared why, means if 22 or 23-year-old person is dying, what is the next, who is going, how to get investigated. So I will try to touch most of the point what I know in my last 2 decades in the cardiology, and I will be touching all the areas where we can rectify and make ourselves foolproof that whatever is there, we'll fight it back. So I think light, if we can reduce, it will be better. And everybody is comfortable with English or you want Hindi as well as Telugu? I am Hindi में. आप लोग हिंदी में भी चाहते हैं? So I will try to touch wherever possible in Hindi also. Sorry. So are we all swasth? Means the theme is the word healthy, healthy word we use. But what swasth is, it is derived from Sanskrit word. Swastha means whether we are really established in ourselves. It is a very big goal, very difficult goal, but still we take it very lightly. Means our whole potential, starting from our physical, mental, spiritual, everything should fall in the line. Then only we are going to say swasth. And our mission is for that. If at all we want that, yes, we should be swasth. So the story is, or we can say our presentation will be more aligned with the swasth, how to be. I'm not going to discuss more about the diseases, but this is the question for the audience. How are you going to live longer and healthy? Eating and lifestyle, preventive diagnostic evaluation and treatment proactively, means wherever possible, having a doctor in the family who will detect the disease before it affect you, or living in the Himalaya away from the pollution and pure environment. What is the answer from, means, what is your take? Means if I have to ask from you how you are going to be healthy or live longer, this word is very important, live longer. First. First. Huh? Preventive diagnosis, second also. Preventive diagnostic, second, okay. Having a doctor in the family will not detect? Okay. And what about the Himalaya? Huh? So you have to wait till end. I will come to the answer, and who will be giving the right answer? I think answer is beyond this one, and it will be in the slide also. If somebody has detected the answer in the slide, they will be given the one prize for them, and the prize will be something very good for them. This is a one book which is going to really change your understanding about the disease. Pardon? Yeah. There is all the four options are in. Four, living in the Himalaya away from the pollution and pure.
I'm saying, you said that the question is how are you going to live longer and healthy?
Yeah.
Whether by prevention, diagnostic, treatment, having a doctor, or using Himalaya, and none of them solve the problem.
Yeah.
Because
So,
you don't know how long you live, even if the doctor exists. You cannot say whether you may be able to say you are healthy.
yeah.
Because your symptoms will tell you whether you are healthy or not. But not by a doctor.
Yeah.
Doctor will come in one day when I got symptoms.
Let us go ahead, please.
Sir, this is just, I wanted to open the question because this question is for everybody because everybody want to live longer and healthy. And we are having our own inputs for that. And that's why the answer will be coming in the one of the slides. So be careful whatever the slide is there and probably you may capture where it is written. So we are having the choices. Whatever is going on, whenever anything is happening, immediately the choices is that we should go for the diagnostics. There are a lot of packages are coming, and I think per day, if you are in the newspaper or anyway, you will be getting that whole body checkup 60,000, and these are the things. Somebody is coming with a 60,000 packages also. We will evaluate you from the cancer to the cardiac, anything detected, and it will be diffused so that you are going to live longer. This is the claim that has been put in one of the hospital where I was working. I don't want to name the hospital, but yes, there was this package was going on 60,000. And the second approach, what I was discussing regarding the diagnostic evaluation and angiography, calcium scoring, whenever the heart disease started, these are the two important evaluations will be coming. Whether you are having some diseases which is what is called hidden inside you, which we can detect by doing the angiography. If you are not ready for angiography, they will say, okay, we should go for the calcium scoring. We'll detect where the calcium means there is some blocks. Then if the blocks are there, we're going to rectify, and finally we will solve the problem so that you will not develop heart attack or sudden death. And these two roads are very commonly, but I'm not going to touch those things. But the truth, what is going beyond that, I am going to. So calcium scoring and blocks. This is, I think, everybody know. But this is one of the important slides that everybody should know. Okay, whatever interventions we are suggesting as a cardiologist, in the situation to detect proactively. Proactively means the person is not having any complaints and we are evaluating by others mean. If a person is very active, he is walking, he is doing his day-to-day activity without any difficulty, even your treadmill is positive. Treadmill, I'm saying, treadmill is positive. In that scenario also, if you are going to put a stent and expecting that your life is going to be longer, it is not going to prolong the life and not going to reduce the MI, means heart attack. So whatever the interventions we are doing, it has got a limitations. It is only and only working on your symptoms. Like if you are having chest pain, which has not been relieved by taking the medicines, certainly it is going to relieve you then and there. If you are having one or two blocks, put a two stent, come out. If you are having three blocks or a difficult area of block which can't be touched by the stenting, we can directly do the bypass. Minimally invasive bypass means we can just put a small cut and put all the three grafts and come out. So all the possibilities are there, but this possibility is not going to reduce the risk of heart attack. And this is you can see these are the four trials. This means we wanted to see if we are going to put the patient on the stenting versus the patient who are only taking medicines. What is the difference happens? So difference is you can just fix the pain, not the longevity and heart attack. That's why the diagnostic evaluation is not going to prolong your life. Now question arises, sorry. So we have to look beyond the what is the blocks, and these are the newses when we are what do you call, somebody is exercising, somebody is very active doing gym, they what do you call, arrest. The question arises again. Only one thing: if you see the narrative of the media, they will say the block was undetected. It would have been checked. CT angio, calcium scoring should have been done. If anybody is going to the gym, we will detect and we can prevent the heart attacks. But the story is not correct. Regarding this one, I think this is also a very. So everybody has seen this video, the girl from Vidisha who was dancing and later on she collapsed. And this story was also saying that heart attack is happening at the age of 22, 23. She is around 23-year-old and she was an MBA graduate and during dance. But the important part here is her brother, at the age of 12, he has died. So importance is there is something which we call as a genetically defined diseases which run in the family. So everything is not blocked. There is something called genetical diseases which run in the family, and that can be cause of those things, and that need a totally different way of evaluation. Sorry. So this is again one of the story of my patient. So he was 22-year-old, non-smoker, non-alcoholic, means there is no as such any bad habits of the conventional we call as a coronary artery disease, means there are some risk factor on which we detect. And he was having one of the major artery, it was totally blocked. And the good thing, we can say the worst part is that his mother is a nurse. Even she is knowing everything. The person was having pain, and later on, 2 days later, they came to the hospital. We find that one of the vessel was totally having a block. And this block was later on, we just took out by, we call it a thrombosuction. And we have not put the stent because he's 22-year-old. We don't want that any foreign body should be there and it will create a problem for the long term. And finally, this patient, when we evaluated, so the new evolving risk factors are coming. So one risk factor, this boy who is 22-year-old, from the corona time, he was enjoying all those things. If you can see, he was bit obese. Means second 10 to 12 hours he was on the mobile, or we can say computer system, playing with his friends online, we call gaming, binge eating in the night times particularly, and totally sedentary lifestyle. So if you see in every family, you will be finding one or two boys. I will not say girls, how much they are, but some boys will be always 3, 4 nexus will be there. One will be sitting in the other house. From there, they will be playing whole night. They will be playing. Sometime, if they have not been checked, they will be eating, drinking. Drinking means cold drink. I am saying, not the hard drink. And these are the things which invite a lot of health-related issues at a very young age. So those habits need to be addressed, and that's why food, which is the one of the important things which we have. I want to do. So regarding the food, there is always a confusion. What are the good? So vegetarian, non-vegetarian, south versus north, oils. These are the common area which everybody want to know. And the answer is whatever you are taking it. It is a North Indian for the North Indian person, South Indian for South. And if anybody is enjoying both the things, there is nothing wrong. Anything is good. Only thing is the quantity what we are taking, that we have to keep a watch regarding the caloric intake. Veg versus non-veg, it is open now that vegetarian diets are always and always better. And there is a reasoning behind it. When you are taking non-vegetarian food, there is what you call, there is a components which later on get metabolized and they form TMAO. So trimethylene amine oxide, this is formed, and this is one of the notorious molecule we can say that is still in the circulation and which is responsible for all the inflammation, starting from cancer to the inflammatory diseases which we call as atherosclerosis, means vascular inflammation is taking place. And those inflammation is responsible for all the problem. If you are having a stroke in the brain or heart attack in the heart or any kidney related, everything start in and around by this one. So if you are consuming too much, certainly it is inviting the problems. So vegetarian diets are always and always better. And there is second reason also. If we see from our intestine point of view, it is more of a vegetarian, like a cow and buffalo, like if you can see from that, the ruminants. So bacteria inside our guts have some responsibility of digesting those food. Even our teeth, if you are going to see, only one canine teeth is there in one side, altogether it is 4. So only 4 canine teeth which are needed for the your non-vegetarian diet. So our molar, from starting from the teeth, from the gut, everything is more in favor of your we can say vegetarian diet. We can survive for the non-vegetarian also. That's why the canine teeth, we can say the non-vegetarian options are also available, but we should not totally go for it. And nowadays there is a changing, if you have seen in your family or not, anybody who's going for dental procedure, after that, within 1 or 2 weeks, you will be getting some news that there's something has happened, either heart attack or something related to the cardiac problems. And the root is, recently we were not knowing that how much important the gut bacteria and the oral bacteria. So recently it has been, means one of the important journal in our cardiology, we call as Circulation, which is one of the highest rated journal internationally. They have found that before the heart attack happens, there is a change in the bacteria in our oral mucosa. So those bacteria which you call the native bacteria is getting replaced by the pathological bacteria which are going to change the whole milieu of the what you call circulation, because they are going to release some inflammatory things, and this inflammatory components is going to make the blood thicker in a very short time, and the clot formation happen, or the plaques which is lying in the heart, or you can say the circulation, they get burst out and immediately the heart attack happens. So these changes are happening. So all the changes means, because regarding the why the blocks is developing, which is at the age of 13, we are having some what you call fat deposit in our vessels. But why it is manifesting at the age of 60 and 70, we are not knowing. We are still finding the reason. And one of the reason what we got in that one, if you are having any dental related issues or your food habits are changing, it invites the problem. And that's why if you are totally on the vegetarian diet, the chances of being those type of problem will be less. If you are going for dental procedure, probably the what you call a drilling type of procedures, the risk will be a bit less. So all the cardiac patient, I strongly recommend, don't, if you want to go for the what you call dental extraction, it's fine. But somebody is giving a suggestion that we will be drilling, we are going to root canal treatment, try to avoid as much as possible, because this is not going to be a good in long term. Sometimes you burn your hand also. So far, we know that we are having genetics from our parents. And these parents, genetic, one from father side, one from the mother side. But there is a parallel, what you call, inheritance we take. One from the father and mother, what you call the cells, and other important thing, the microbes. So these microbes are very important component of our what you call disease evolution. We can say the flora. The flora of our body is going to define whether you are going to develop the cancer or heart disease, depression, relationship issues wherever you are working. Everything has got here and there some touches of your microbacteria. And whenever what I was saying, swasth means these bacteria, what you are keeping inside your, means what we have taken from our parent or particularly from your mother, within the first 3 months are going to be matured, and usually they will remain like that. If due to our food habit, our what you call environment, when we are changing, these bacteria changes. If you are a vegetarian and your parents are vegetarian and you are taking non-vegetarian, you are going to fiddle with these bacteria. These bacteria will having a different way of their growth, as well as there will be changes in the bacteria, and these bacteria will certainly invite the problems. So you will be seeing in the families the persons who are vegetarians and later on go non-vegetarian, they started having the problem at a very young age. And the reason is, it is not only the genes, the bacteria which we have taken from our parents, particularly from the mother, is one of the things which we have just destroyed, or you can say damaged. And if you are going to count from the what you call our cells or our genetics is, our means what cells we are having, and the bacteria what we are having. The bacteria are more than our own cells. The genetics, what I mean to say. And these are the genetics which, if you can say, it outnumbers. So number of bacteria, we are having 10,000 to our own cells. So how much important it becomes to think about regarding the how to preserve our bacteria. We can, हम लोग की धरोहर को हम लोगों को बचा के रखना है. तो एक तो धरोहर हम लोगों की होती है कि जो हम लोग अपना जेनेटिक्स लेते हैं, मतलब इनहेरिटेंस. गुड इनहेरिटेंस मीन्स कुछ लोगों को आस पास मिलता है, मनी नहीं मिलता है, दूसरे को सेल्स मिलते हैं, गुड सेल्स फ्रॉम देयर पेरेंट. एंड थर्ड इज द बैक्टीरियाज व्हाट वी आर हैविंग. सो सारी चीज़ 80 to 90% in medical science we are not able to know why this person has developed hypertension. उनसे हम लोग when we ask the question whether your parents were hypertensive, at what age? If they say my father was hypertensive at age of 45, we give okay. If your father was having hypertension at 45, then in and around the same time you will be developing, or maybe 5 year or 7 year early to their age. And the reason is the parallel genetics, what you call cells, and second is the gut bacteria what you are having. And this was, I think, I have already touched this point regarding the how the gut bacteria, if you are taking non-vegetarian diet, so kidney fibrosis, heart failure, or you can say atherosclerosis, which is called blocks, which is thrombosis, and all the issues in and around are starting from gut. So we exist between outside bacteria and inside bacteria. This body what we are having right now, if you can think about it, there are a lot of microbes outside, from bacteria to virus to fungal, everything is in this environment. And on top we are having a bacteria which is inside our intestine, oral mucosa, on the skin. So these are in very harmony. The time we start damaging it, we invite the problem. The persons who are using too much antiseptics, you will see that after that their skin will become more sensitive, because those skin you have damaged the bacteria which were lying and which were good for the skin. You have just damaged it, and that's why the skin becomes sensitive. The persons who are staying more in a very hygienic environment, they don't want any dust to enter into it. They will land up in the condition we call as asthma. Sometimes it is what you call genetically, but sometimes it is invited, because you have never given your immunity to act in a right way. So it becomes more sensitive. So anything is coming towards you, you are your response is hyperactive, and that is the call hyperactive response of the respiratory as asthma. So likewise, anything in extreme is never ever good. So regarding the food, we have gone too much inside the gut. So let us come. So food, how much we are in and out. This is simple mathematics. थोड़ा सा बनिया दिमाग लगाना है, कितना हमने खाया, कितना हमने काम किया. Just balances, that is enough. And calorie, we have to be mindful. Coming to the timing. So timing is a very important aspect. If you are taking the food in the wrong time, because from the hunter-gatherer times, we are knowing daytime is start when the sun is rising, and daytime when dusk time, or you can say the sunset. This is the time in which we have to take the food. And what is happening in the today's, we can say, the pandemic, everybody is the night, 9 o'clock, 10 o'clock, 11 o'clock, and the persons who are working in the IT sector, they are taking in the night, because their night shift is till 2 o'clock, 3 o'clock, sometimes till whole night they are working. And there is no way out for them. They have to work, they have to take some sip, sometimes some snacking. And the worst part is, this is the important one of the study, and it is, there is a circadian rhythm in the body. Every hormone, every enzyme has got its working time. And it is also that bacteria, again, I have to touch those points. The bacteria, they are also having a time to sleep. So if you are taking the food, you are again giving exertion for them. And when you are giving exertion, certainly they are going to exhaust. Sometimes if they are exhaust, these are the first barrier against your disease. So if you have just damaged it by your eating habit, when they are supposed to sleep, you are saying, okay, now get up. I have taken something, you have to digest for him. And your digestion by your enzymes and the juices are bit less than what they are doing. Sometimes people ask from me, sir, I am a non-vegetarian, why my vitamin B12 is deficient? And the answer is, if I have to give the answer, vegetarian persons, we can expect the vitamin B12 deficiency. But out of 100 vegetarians, around 40 to 50% vegetarians are having normal vitamin B12. And around 20 to 30% of the patients who are non-vegetarian, they are having vitamin B12 deficiency. How to explain it? Anybody? Huh? Correct. So this is the way we should think about. But medical science, when I was doing my MBBS, we have been taught everything means we are robot. You have to take from outside. If you are not taking, that's why the calcium supplement, magnesium supplement, a lot of supplement has been in the market, just giving that you are having this deficiency. Your food is enough. You can't grow apple in this area, but apple can be grown in the Himachal and Jammu. Why? Because the soil, environment, everything. Same thing is with us. When we are staying in this part of the country, and we are having the water and food, all those things, that same things we are taking inside, and our bacteria are knowing how to handle those things. If you are going to give cold drinks, certainly it is going to be damaged, and certainly its behavior will not be the predictable, it will not go in the right way. So circadian rhythm, coming back to this, so what happens when you are just overstraining your bacteria again and taking the food in the night times, it invites all the inflammation and cancers. And this has been proven. It is not it is one of the important center in the US. They have studied in two group of rat. One rat was given the time that between 9 to 5 you have to eat. After that you should not eat. And one rat has been given the opportunity. The same means food was same. It was containing all the noxious, means you are having good amount of fat also, and even junk food, means what you call food which is containing a lot of junk food, that has been given between 9 to 5 versus whole 24-hour circle. The, the mice which was taking time restricted between 8 to 12, or you can say between 9 to 5, even after consuming the junk food, or you can say the food which is not allowed, they didn't develop any problem. And the mice which was taking or enjoying throughout 24 hours, they started developing the heart diseases, they started developing the hypertension and diabetes. The story is that if you are taking the food in the wrong time, it invites all the inflammation and the diseases. So if at all possible, follow the nature's rule, and the nature everybody follow except with the human being. So if you are knowing or not, your dog who are keeping, the dogs are also two variants now. The stray dogs, they are not developing hypertension, diabetes, but the dog who are staying with the human, they are enjoying the same, and now they are starting the having the disease at the young age, or you can say they are also taking the ancestry from the family from which who are breeding them. Okay. Now quantity. So I think vegetarian, non-vegetarian is clear. Regarding timing, we have discussed. So World Food Day, remember, 1/4 what you eat keep you alive, and the other 3/4 keep your doctor alive. So, so frankly speaking, we are alive due to your eating habits, and probably this is the one of the reason we all are facing the problem. One part of the world, they are not having the food. Even 1 or 2 days, they are just striving to get something, and like African country. And in our country, if one time meal is over, everybody say, I am getting weakness. So weakness is not in the food, weakness in the mind. Your body is so much habituated, addicted to the food and your habits. Even one meal, even we can say in place of 3 chapatis, if you are taking 2 chapatis, you will feel weakness, because weakness is in the mind. And this addiction is one of the reason we are not able to stop the temptation, timings, and that's why the importance of habit comes when we are discussing. Okay. So eating, we should do a lot, but what is required is the fasting. So fasting was a practice, and I think it is in present day also. Whenever you are going in any religion, all the religion is saying that you have to fast. And the why we are fasting, anybody can give the answer? Why we are fasting? Yes, but how it is? Yes. So this is the answer I was expecting. Means we are, again, I am coming to the bacterias only. They also want a vacation, at least 1 or 2 days vacation. They should also enjoy it, because they outnumber our own cells. First of all, their genetics outnumber our own genetics. So if we are giving a rest, that they should enjoy it, or they should rejuvenate themselves also, then only the body is going to rejuvenate. And the second important part is, whenever you are taking a fasting, the fasting give opportunity for your all the there are cells in the body which are going to just check which are the cancerous cells, which are the damaged cells, which are not working properly. So if you are giving a fasting, this cell, or you can say the raw agency, is going to work inside. They are going to check where the cells are not working, and they will just take out all those cells, engulf. The chances of cancer will be reduced. So that we can say the signaling system is, whenever you are fasting, it is going to activate, and depending upon how long you are going to fast. So at least 18 hours is the best time, and whatever the recently what I think 5 or 6 years back, the Nobel Prize has been given for this same autophagy. So body activate one system, what I was saying, the raw system, the raw agency or CID, who is going to work where the abnormal cells are sitting, and they are inefficient, they are not working properly, and they can damage in the long term. They are going to just, like a terrorist, they are going to take out and finish it then and there. So this is going to activate, and this is the need of the time for everybody who is sitting in this room, that they should take one day at least, whichever days they are possible, and go for the fasting. Certainly it is one of the most healthiest thing you can do for yourself.
1 day per week.
per week means whatever means you have to start. But yes, 18 hours is the minimum time. That is the in which this autophagy start what do you call activated. If you are keeping less than that, it may not. It may be you are going to reduce your caloric intake. You can make it somewhat negative, but the activity of the what do you call cells which is going to take care for the cancerous cells, that will start after 18 to 24 hours only. So wherever possible. Water is only calories should not be there. Yeah. Yeah. So this is there is a lot of noise regarding the breakfast skipping and heart attacks. The reason is means there is a study also has been done that persons who are skipping the breakfast, they are having more chances of heart attack. And the reasoning is those are the persons who are very indisciplined. The persons who are not able to manage their time, they just think, okay, I will take something, they will take some snack in the way. They are just skip the breakfast, they have reached to the hospital means where they are working, and after that they will over it in a wrong time. Maybe afternoon they are taking breakfast, they have to, night again they will be taking. So night already they are full, morning time they are not feeling like that one, they skip the breakfast. So that is from there it has been spread. But the persons who are early riser and who are not taking breakfast, mostly they will take the breakfast as the nature's rule. As you can see, any animal after getting up, they do two things. One is the stretching of their body, and after that immediately they will go to the water source and take the water. These are the two things you see all the animals, birds, they will be doing, because the whole night you have been dehydrated. And stretching is the things by which you are going to make the body align, your mind get activated so that you are going to work. So breakfast skipping is not a very good idea unless or until there is a strong reason for that. Means if you have enjoyed in the night, certainly you are not going to take, and that time you can skip so that your body should feel lighter when you are going for work. But as such, it is not a good habits in, if at all I have to enumerate. So fasting is not there only. So you can see we have been claimed time and again that Gandhiji has given through the fasting. And if you know about the freedom fighter which has been very underrated or which has not been brought, the Jatin Nath Das, so he fasted for 63 days. So you can think about is what is the capacity. He is one of the youngest, I think at 20 years he has been hanged, or he died in the jail while doing the satyagraha, or you can say the during the freedom fight. 63 days without any food, he survived. And he was around 20-21 years. So human body is having a lot of capacity. It is very underused, and underused for only one reason. When we are not feeling what we are, certainly the people will make you in that way. So if you are feeling that a strong mind, if you are having, you can certainly able to surpass whatever the difficulty comes. If your goals are clear, your mind is strong, nothing will come in between. Usually either of these two things are on downside, then only you start facing the problem. So he was very clear, he wanted. And there are some people who has managed like this one. They in the present sign. So fasting, sitting with the right people, you can go up to the getting the chief minister post also, and you can. So this is all regarding the food. The second part is regarding the exercise. So exercise is an important component that we can't. Why we should exercise? What is the benefit, duration, and who would not do it? So these are the four component. And whenever, any time when we say exercise, if somebody has to ask this question, why I am exercising, they say that I am exercising because I want to reduce the weight. Somebody will say, I feel healthy, I feel good. But there is something which is very important. We can say that if you are clear about why we are doing it, you will be better able to perform, and you will do without any reasons. Okay, whatever I was saying, that is okay, but Why is important? So exercise, whenever exercise comes, the first slide you are knowing that there are three persons who are celebrities, they died. But nobody talk about Milkha Singh. He was flying sick, if you are knowing, and not a single time he has been admitted in the hospital till the last. When I think in the COVID time, he was been one time got some lung infection, admitted, and from there he left the world. And never ever any day he left without running. In his own interview, he was saying one day, if I am having headache, I will discuss with my wife कि I am having headache. So he will say, सरदार जी ये टैबलेट ले लो, ठीक हो जाएगा. वो मैं टैबलेट लेता था, अपने सिराने पर रख देता था, सवेरे उठ के दौड़ने चला जाता था, मेरा सरदार सब खत्म हो जाता था. So for every problem, his solution was go and run. And it is not for him, I also enjoy it. So why we want to do the exercise and running, whatever he was doing. So it is important that we should know this is the only investment you can do for your heart. And what it do, when you are exercising or you are doing anything which is challenging your existing coronary circulation, means heart circulation, it grows some additional vessels. Are you getting this point? So when what you are seeing here, sorry, here this block is there. These are the, I am just showing this is one of the artery. So this is one of the area where the heart is developing block. I am just in a diagram. And these are the small vessels which will start generating when you are exercising. So even this artery is totally going to be blocked. These vessels will start giving the circulation to this territory. So every artery is having its own territory to supply the heart muscles. So one is getting blocked over the time, the other vessels will start giving, which we call as a collateral circulation. So when you are exercising, these collateral circulation get more robust. So even you are getting this artery, suddenly if it get blocked also, nothing happens because this circulation is giving what you call collateral arteries to that area, and you are able to salvage that particular emergency also. Sometimes patient come with a heart attack for last 2 to 3 days. Some pain was there, later on taken medicine, I was feeling good, but some discomfort was there. When we see the ECG, it was ongoing heart attack, and he is coming by walk after driving and doing all the chores at his office, at his home. And the reason is when we do the angiography, we find that these vessels has been, whatever the blocked area has been reperfused, or you can say it has been well collateralized circulation, means the artery from other is giving the circulation. One is blocked, that time pain. The collateral has started feeding it. Pain has been somewhat relieved. And in that scenario, he is able to do all the activities. So this is the thing what I was saying. So these are the collateral. Whenever the blocks are developing, you are going to grow these collaterals. And this is the reason I am saying for everybody, whoever is sitting here, if you have to take only one habit in your life to stay healthy, to stay stronger, stay away from the hospitals, this is the only habit, exercise. Exercise should be the part, means like you're taking the food, it should be, without fail, you should take it. If you are diabetic hypertension, it become must for you. And this collateral circulation, what I am saying, it can't be grown by any means. If you are exercising, if you are giving a challenge to your heart, that yes, when you are doing 1 kilometer, you are going for 2 kilometer, what it is going to do? It is having the same circulation. Now it has to given a challenge that, okay, now I have to provide the pumping over the time for next 1 kilometer also. So what it will start sprouting these vessels. There is no mean to sprout these vessels. So this sprouting will develop when you are exercising. And this is one of the reason, even the 3 arteries are blocked, the patient is able to walk, doing day-to-day chores without any problem. Because when we are doing the angiography, we are showing you this part only. So this part will be visible. Everybody will say you are having 100% block in 2 vessels, and he is saying I am not having any problem. How to explain it? Because this is the hidden part which is not been visible in the angiography. Because the resolution of angiography is up to 500 microns. So below that one, whatever vessels are there, it will not be visible. And you will be astonished why the doctor is saying that I am having 100% block, 2 vessels. You get scared, family get scared, and the patient is saying, no, I am doing everything. Why I should go for the bypass or stenting? I am doing good. The reason is this collateral circulation. And the growing of this collateral circle, you will find in those persons who are very active. They are going for friendship circle is very good. They are going for all the activities while walking, running, or cycling. So these type of persons will, even though they are been stuck with the heart attack, they will come by walking. They go by walking, and they face the problem very without less pain, or you can say without pain also. So this is one of the minimal pain will be there even in the presence of heart attack. And this is the graded exercise, means when you are doing slowly over the time, you will find that your heart is able to withstand whatever the blocks. So that's why I was saying the detecting the block is not going to solve it. You can still do good by your own habits. So this is the, you can see the circulation is going. So when one of the arteries is getting blocked here, the circulation from this collateral circulation is giving circulation. So it is called natural bypass. So you can naturally bypass all those hurdles of the circulation. Benefit of exercise, I think we know. Mind your step. So your longevity depends on it. How much steps you are walking and what space you are keeping, certainly it is going to make a difference. So steps from 200, 850, 16K, the chances of your heart attack, or you can say heart failure, both reduces. So studies are coming, and every time they will be saying 10,000, somebody will be saying 7,500, but something is better than nothing, and whatever maximum you can do in your capacity is always better. So for this, growing the collateral circulation is your responsibility. Nobody is coming for you. Nobody is going to push you for it. It is your responsibility why you want to do, and the working exercise the only two. You can't get anything. Graded exercise will open the new collateral circulation. There is no alternative other than the exercise. And the persons who are doing after heart attack, they are the persons you will be seeing, they are reaching to the hospital with less pain or no pain or mild pain. The reason is they are having the collateral circulation. So everybody is investing for the, what you call, income. So there is a health investment. So when I ask this question from anybody, have you done a health investment? How many people have done the health investment here? 1, 2, 3, 4, a lot of people. So what do you mean by a health investment?
Working towards your health, maybe adding good food and
Yeah.
workouts as part of your routine, daily routine.
Very good. So this was the, I think he has understood right, because health investment is nothing like money or insurance. A lot of time people think that health investment is like we have put 50 lakhs का हमने अपना इंश्योरेंस करा लिया तो कोई भी चीज़ होगा I can face it very easily. Health investment is the time you invest in your habits which is going to make you healthy or you can keep you fit. And that is the same what one of our, you have to invest the time for your health, and that is, you can do any exercise. And I am again saying, challenge your body time and again. It will certainly pay you with better interest than anything else. Even in the, I think, management also, the best thing, everybody say that if best investment on yourself, in your skill than anybody else. Same thing is for health. If you are investing on yourself, keeping 30 minutes, 45 minutes going for walking or cycling, it is really a big investment in your long term. It may not come out in the short term. And it is the investment which will give its best return when other people who are not doing, you will see after 35 to 50 in between, they will start being under the grip of the diabetes, hypertension, and a lot of health related issue, and you will be selling the things because of your habits. So invest wherever possible. So health insurance is the money and health investment is the time. Duration. So duration is, it depends upon how much you are serious about your health. So whatever you can do the maximum, and always when patients or you can say the family member come to the my clinic or you can say in the hospital, they say, sir, time nahi hai. So for them who are sitting here, exercise makes time, not take time. So if the meaning is, if you are investing time for the any exercise, your post exercise, or you can say post exercise day, will be very efficient, because it is not only the muscles, it is the brain also which start working very well, and lot of things release, starting from the serotonin, endorphin, and dopamine, which is going to make the changes in your body. And at the same time, one what you call molecule related BDNF. So even your injury or brain injury is going to recover very fast. So chances of even after the stroke, your recovery will be very fast. Go and see the persons who are the top performance. If they develop health related issues, they immediately come out. They may go to the up to the level of ventilator also, but you will see after 1 week or 2 weeks they are again on their same cycling and all those things. And the reason is they have nurtured their health by that. So there is no excuse for that. So 150 endurance exercise, 75-minute vigorous activity. This has been given, what you can say, a lot of guidelines are there, whichever suits you. But first is step out from your house wherever possible, take some exercise in the house, do the yoga, whatever possible. Or if you are going to gym also, that is not a problem. And exercise can be anything. If you are going for Zumba dancing, it is also exercise. It is also a good way of enjoying the time and for the health point of view. So, anything. Who should not do? So, these people have been labeled that they should not do it. Kumar and Raju Srivastava, they were doing the, I think, gym, and that time they died. And the whole media has started making the story of the blogs, and they say that everybody should get certified before entering the gym. But nobody asked this question from the journalist, why he died when he was exercising for maybe 5 years, 6 years on that particular day. What was the exercise that killed him? What was the specific of that exercise? And why exercise killed on that particular day? The answer is exercise never kills. It has some triggers, some conditions are there which can get triggered, and it is the day also. Grah bhi hote hain, din bhi hota hai, everybody has to die. And everybody has got a day of death which has been well written. We have to follow it, we have to accept it. And these people when we are regarding the we can Rajkumar, we are not knowing how he was living. If you see from the nature's rule, what I have discussed regarding the food habits, nighttime shift, nighttime, and taking the injections for the getting good muscles and doing the gym without taking the proper rest, it is compounding over time, and one day it will blast. So for him, I am not having much issues, because the celebrity's way of life is a very tough, very difficult to sustain for a long time if you are not very much disciplined and not having a very strong mind. So their situation are totally different. We can't correlate with the exercise as a killer. It is not possible. It will always give an edge over the anything else. So these all are myths. There are only 4 or 5 conditions that I have just bring in the public domain. These are the conditions. If somebody is diagnosed, they can think about that they should not exercise, or they should exercise in a proper way, or they should be under the supervision. And you can see these are the conditions like CPVT, long QT, congenital anomaly, hypertrophic cardiomyopathy, ARVC. This all can be diagnosed by just 2 things, ECG and echo, and sometimes genetical evaluations. And they are very, very rare conditions. They are not common conditions. So if they are having this type of problems, it will trigger. Exercise will trigger some rhythm problem, and they collapse, they can die also. So in this condition only we can think that yes, exercise is barred for those. They should not go for the exercise. They should be away from the exercise. And these are the conditions only. So there are only 4 or 5 conditions. Sedentary lifestyle is one of the important component of our life, particularly in the urban part, because and it has been 8 hour or 10 hour if you are sitting, it is almost your risk of developing heart disease equivalent to the person who is smoking. So that's why it is now the norm is sitting is a new smoking. So if you go and see most of the persons who are working in the corporates, or you can say the IT sector, they are having 8 hour, 10 hour, 12 hour. Initially they were working in the their workplace. Now at home also they have to do the same thing. So this spilling of what you call sitting habit is one of the important reason for developing disease at a very young age. So your risk versus the smoking risk is not different. You are still smoking if you are even not smoking if you are sitting more than 8 to 10 hours. And sedentary lifestyle increases around 40% risk of heart failure and CV means cardiovascular. So it has been already well proven. So sitting wherever possible, we have to avoid it. And sedentary lifestyle is not a important. It is an important part of your health care. Now, everybody is here and everybody want to know how to identify the heart disease. So I will just briefly touch one or two points. And everybody has to self-verify themselves because something you can still find that these are the things I am having and I should go for the evaluation. So these are the 4 or 5 complaints which are very, very important that everybody should know. Chest pain, everybody know. Breathlessness, ISM, or we can say सांस फूलना. पीडल एडियम मतलब पैर में सूजन आना. फैटिगेबिलिटी मतलब जो काम आप पहले से करते थे उसमें थकावट होना. पाल्पिटेशन, धड़ा मीन्स धड़कन का फील करना. लॉस ऑफ कॉन्शियसनेस, गिडीनेस, सिनकोप मीन्स फेंटिंग कर जाना या एक पे एक कोलैप्स कर जाना. And any history of sudden death in the family. These all are the heart diseases symptoms. It may be in the family, it may be in the person. If anything is there, then certainly it needs evaluation. So now coming one by one, these are the only 4 type of diseases what we are seeing: valve diseases, vascular diseases, muscle diseases, and electrical diseases. So valve disease means they are having 4 valves. Mostly the left-sided valves are mostly diseased, and whenever it is diseased, they will give a particular type of symptoms that most of the time doctors will diagnose. Cardiovascular diseases are the diseases which are very, very commonly discussed, and all the evaluation is on the same domain. This is a cardiovascular, means blocks in the heart circulation. This is a generalized disease which will be happening all over the body, but manifesting and mostly evaluated in the cardiac. If you are developing the stroke, it is also a vascular problem. The vessels is getting choked due to the fat deposit, or you can say the clot deposit. What has happened? Same thing for the heart. We call as a heart attack, or we can, in the common language, in the medical language, we call as a myocardial infarction. For the brain, we call it a stroke or CVA. And sometime if it is affecting the peripheral vessels, while walking, you will start getting pain in the leg. And when you are standing, it will reduce. We call it a intermittent claudication. So these all are the manifestations of singular disease. We call it atherosclerosis, inflammation of the vessels. So if it is happening, it is going to clog the vessels slowly. And when it is slowly clogging the vessels, you will get the symptom in a particular threshold. After walking for at least 500 meters, you will be getting this complaint. The time you take rest, it will relieve. So this type of symptoms, if it is happening in the leg, we call as intermittent claudication. When you are walking and it is happening, we call as an angina. So these 2 symptoms are of the same disease, different manifestations. Coming to the electrical disease, this is the what you call dil dhadakne do, jo hum log bolte hain na. So our tagline is from this: we want the electrical system should be, the diseases related to the electrical system should be known to the people. What are the symptoms? Because these symptoms are misdiagnosed. It go in a different domain also. Sometimes they are going to neurologists, psychiatrists, or even orthopedics also. And the problem is in the heart, and that is the electrical problem. And there are some muscle diseases, means the muscles will be getting thick or it is getting diseased, and later on the heart pumping is getting reduced. So these are the 4 type of diseases. Atherosclerosis, just now I discussed the blocks, the story of block, 50%, 99%, whatever it is there. And we should be known that more than 70% block is the block on which we have to go for any interventions. Chest pain and angina. So this is, everybody is having here and there sometime chest pain, and they get scared by getting the news that heart attack is the one of the, chest pain is a manifestation of heart attack. But at this time, it is very important we should know what exactly is the chest pain on which you or we all should be alert. So angina means you are having a discomfort on the front of the chest, and when you start walking, it should increase, and the time you take a rest, it should reduce. If these 3 pointers are there, means it is heaviness, not pain, heaviness, which comes on walking and reduces or relieves totally on taking rest or taking the sorbitate, what we call tablet, it is called angina. Until proved otherwise, it is a heart symptom, or it may be ongoing heart attack, you have to reach to the hospital. If it is associated with sweating, weakness, radiation to the arm, radiation to the jaw, or radiation to the umbilicus, up to umbilicus. These are the symptoms that should not be taken lightly anytime. And the sensation, what patient will say, or the person will, if something has been kept on my chest, that type means this is something the person who has never developed heart attack or who has not having this term, they may not be able to understand. The sensation is like something like put the weight on the chest. So pain, somebody will say hair is there, sir, hair is there. We say, okay, no worry, go get ECG, come back. Just for the legal verification that you are not having any cardiac issue, we have to do it. But if you are able to point the pain by your finger, it is against cardiac. You can say that it is not a cardiac, but yes, you should go to the doctor. So angina is basically the blocks are getting unstable. If it is happening in the rest stage, then it is a medical emergency. And sensation is very, very important. Chest, arm, up to umbilicus, up to jawbone. If it is going, and while walking it should increase, that is very clear. If you are walking, it is increasing. You are getting profuse sitting at that time. Think about that is a heart attack. Anybody is there, immediately rush to the nearby center so that it can be diagnosed properly and treated properly. So sudden onset, progressive chest discomfort, heaviness, breathlessness, along with profuse sweating, minimal activity or rest, it is a sign of heart attack. Whenever it is developing, immediately reach to the nearest center. Sometimes it is a pressure squeezing sensation. Sometimes people say that I am having gastric problem. They will take Eno and they will feel that somewhat better. But most of the time, the gastric problem, if the person is having this gastric problem, will be different. The time he will start walking, it will increase. And even after taking the antacid or a Gelusil or whatever the medication, it will not fully go. So anything which is not relieving on taking the antacid, you should try to get at least ECG done. It will rule out or rule in the diagnosis of heart attack or microinfarction. And if at all somebody develop the heart attack, what next we have to do? Because whatever we are doing, we are just want to know whether heart attack is going or not. And heart attack is not a disease on which we can say that I am not having habits, I will not develop. It is like a terrorist attack. It can happen to anybody. Yes, some age groups are very common. Some people who are having risk factor, they will develop more than the other person. But what we have to do, reduce the mental tension, means the person should not start walking here and there. Reduce the physical activity, reach to the nearest center, whatever you have to plan it out. And it is the responsibility of everybody who is staying, what is the available hospital where they should go and in the situation of heart attack. Because this is called planning. You have to do something happen in the family, where to rush, what are the number I have to contact, what are the people we have to see, so that you can cut down the time to reach to the hospital so that the complication of heart attack can be prevented. So if a person is developing chest pain, they say, okay, we will see till morning, later on we'll see. Or we can show to our particular doctor and take our opinion who is staying long distance from the place. It is not right idea. Whenever you are stationed in a place, see within 2 kilometers where you can reach within half an hour to 30 to 45 minutes. That is the best center, and you have to choose in your place. And never try to chase. Sometimes people are from the Sikandrabad and the doctor is staying in the Gachibowli due to any reason, or they have gone in that place, now they are here. When the chest pain start happening, they will say, okay, sir, I am having pain, where to go? And he will say, okay, come to me. Sometimes it happens. Most of the time the doctors will be saying, okay, go to the nearest center, do the ECG, what I say, and send the ECG. If the ECG is showing clear-cut finding, we will say, okay, get it admitted to the nearest center and let them intervene, because the time you are passing in the traffic may kill you also, and it may not be fruitful for the patient. So try not to chase the doctor. This is a story of one of the doctor. So, and this is important to say that he is a teetotaler. He has been in the highest peak of the army, what you call Siachen. Siachen, he has been for almost 6 months posted there. He's a doctor, 28-year fitness freak. Every day 10 kilometers he is running. He's from army doctor. So you can understand how much well trained, and at age of 28, he called me in the morning hours, and this is the angiography of this doctor. So you can see the artery is totally blocked. This is called right coronary artery, it is totally blocked. And he came with his wife while driving. When he was running on the road, he developed some chest discomfort. He himself diagnosed that I am having some problem. I have to go to the doctor, to the centers and get it confirmed. He stopped running. He took the vehicle, came down to his own hospital, took the aspirin, took the morphine, which we give for the pain relief point of view, then came to care where I am working. He was sitting for almost 20 minutes in the thing. I was in the cath lab that time, and he told, "Sir, I am having some discomfort." Very easily, without any difficulty, he was saying, some difficulty. I did the ECG, there was some minor changes. Minor changes, but the changes are not very much evolved. Then I did the echo. Echo was showing some early changes of the heart attack. So I told better we should go for the angiography. And I was also surprised. He was not having any risk factor, genetically negative, means the parents are also not having any genetical link of heart disease. And after that, we have just taken out the clot and the vessel is totally normalized. So what the message is, why this person was, why this doctor was having all these blocks also, and he has completed the walking and he reached to the hospital. The reason he was having a good collaterals. So the RCA was blocked and LED was giving all the circulation. Initially the discomfort was there, but the collateral started giving so much blood, the pain was almost relieved, and he was able to drive, wait for 20 minutes, later angiography around 15 minutes, and we have taken out the clot. Now he's off the medicines almost, except for some antiplatelets we are giving. So there are two things in the heart attack. So one is the circulatory block, which everybody discuss, and second is the electrical failure. So whenever anybody is developing heart attack, if you are having two blunts at the same time, one is circulatory block, the artery is totally blocked, and the second insult, what we call electrical failure, we call it the ventricular tachycardia, ventricular fibrillation. These are the lethal rhythms from the lower chamber of the heart, we call it the ventricles. If we start beating around 180, 200, then the survival is very, very difficult. I will say not possible, but very, very difficult. The reason is artery is blocked and electricity is also failure, because heart will stop immediately. And these are the unfortunate patients who die at home or who are dying during the transportation. So these two insults can't be prevented in any way. You can try to prevent the circulatory problem by the lifestyle, all those things. But when the heart attack happens, the prevention of electrical failure is only and only one thing: how much ischemia, means how much oxygen deficiency the area is getting. So if the excess oxygen requirement is there and the muscles which is damaged, the chances of developing the electrical failure will be very, very high. So this electrical failure will not happen in this type of patient who are having already grown up vessels from their lifestyle, or we can say, and they are able to drive and they can come to the hospital. So that is why exercise is one of the important salvage tool for everybody. So heart attack and cardiac arrest both are different. So heart attack, okay, you can reach to the hospital. You can come with the pain. We will open the vessels and you will be fine. But cardiac arrest, if happens, means electrical system, VTVF or rhythm problem has happened, then it is the God wish that you will be reaching to the hospital, or the wish of the person who is there who can do the CPR, and in between the rhythm turn to the normal, then only are you reaching to the hospital. So whatever the story you have seen in the initial stage that they are doing exercise, they collapse, or the girl who was dancing, it was the story of cardiac arrest. So cardiac arrest we are not able to prevent by any means. Even in the present scenario, the most common cause of cardiac arrest is the blocks. But those for the person who are 40 years older, under 40 years, the cause is sometimes muscles diseases, sometimes the electrical diseases. And that's why the girl, what I showed, the history of 12-year brother who has died, it is a genetical link which was going on. So there was some under-evaluation and some more information needed in the evaluation that can give answer why she collapsed and what best can be done. And the best thing is we can do the CPR so that patient can be reached to the hospital, and after that we can do any intervention or evaluation. So whenever it is happening, the opportunity is with you. So if you have seen this movie, Kantara, so this demigod, you all are demigods. You are having the opportunity to make the person live. And this opportunity comes with CPR. So learn the CPR, do the CPR, either in the family or on outside, wherever you are finding two things. the person has collapsed and he is not taking respiration. And third is unconscious. Three things has happened at the same time without fail, without thinking too much. Be in the reflex, start chest compression in the front of the chest at a rate of 100, if you can do it, and immediately take the call for the medical team to attend it to reach to the hospital. If you are able to do, I have seen one or two patient has come, the father is having this cardiac arrest at the home, washroom, he came out, he find that he has become unconscious, no respiration, he started tapping, no response. He started doing the CPR, and the CPR, they did it, they came to the hospital, and we find that yes, he was having cardiac arrest. One time we have given the CPR, patient revived. Later on, we found that one of the valve, aortic valve, was totally blocked. Totally blocked means it was having severe stenosis. We have changed the valve. Now he's doing good. So it has means while motion, he has fought with his wife very furiously. Very high volume talk was happened, having a lot of emotion, and suddenly he developed this problem. And it was good that his son was knowing how to do the CPR, and that was the reason that he survived. So CPR is the one thing. So the demigod you all are, we all are, we can say. There is no need of taking any degree for that. It is only the training. If you can be train yourself, certainly you can help a lot of patients. So this is regarding the two part, what we can say, the blocks and the electrical problem. But sometimes the heart become weak, the pumping is getting reduced, and the symptom will come that breathlessness. ISM వస్తుంది కొంతమందికి. Somebody will be having low energy level, means they will be, that activity which they were enjoying, they are not able to do, they get fatigued and weight gain. But important thing is the pedal edema, means swelling in the feet. And anybody who's taking the medicines like amlodipine or cilnidipine, so they will be also having the same swelling in the feet, and they get too much worried that it may be due to the heart failure. So there is a difference. If you are getting breathlessness with the swelling of feet, it is a clear-cut indication of heart failure, means heart pumping is having some issues. If you are getting night time while sleeping, breathlessness means you have gone on the bed, you are sleeping, all of a sudden you started having a lot of breathlessness. You have to sit up for at least 18 to 20 minutes. It took to get relieved from the breathlessness. We call it a PND. If it is happening, it is a symptom of heart failure. And just echocardiography, it will diagnose it, nothing else. No need of a lot of what you call total body checkup and all those nonsense, not needed. Do echo, it will just establish it. But we should be aware what symptoms. Swelling of feet with the breathlessness, which was not there any time. If it is happening, we have to get a cardiac evaluation. So if somebody is sleeping like this one, putting too much pillows, one pillow, two pillow, three pillow over the time, he is also having heart problem. So he will be more comfortable in sitting like this one, and when he will be just lying down, he will be becoming breathless. It is a symptom of heart failure. We call as orthopnea. And this, I was saying, what the person is having night time, he has slept, and within 2 hours of the sleep, he sit and see, I am not getting breath. He is opening the window, and then after getting some time, he getting comfortable. It is also feature of heart failure. So these two things are, means, sometime it is been shown to the respiratory doctor, they will go that he is night time, he is behaving like this one sometimes. So if you are aware, this is called paroxysmal nocturnal dyspnea, means breathlessness which is happening in the night time. It is due to the heart pumping issues. Regarding one of the risk factor, hypertension, I will just touch it. Hypertension, everybody get worried when the diagnosis, they start stopping the salt, they start running everything. The motivation is for a few days, and then when blood pressure comes down, immediately they leave it. So first of all, diagnosis should be very clear. Anybody is diagnosing a hypertension on first onset, means you have gone and he has seen blood pressure, you should take the medicine. That is not a right way. If you are not having a strong family history and a particular age group, you have to wait for a while. 1 or 2 readings may be needed. Maybe weekly blood pressure over a 1 week time will give some view regarding whether you are hypertensive or not. Everybody is having blood pressure. The blood pressure on which we have to act by the lifestyle and medicine is called hypertension. So the resetting of your normal blood pressure, which is different for the everybody, means somebody will be having 100 by 10, 110 by 70 as a normal, somebody will be having 120 by 70 or 120 by 80, one will be 130 by 90. So 140/90 is the cutout. Persistently, if it is crossing, persistently means if you are by your lifestyle, if you are not having pain, you are not having fever, not having body ache, not having relationship issue or workplace pressure, stress, what we can say, and your blood pressure is shooting more than 140/90, this is a time where we have to intervene as a doctor. First, give the attention by the diet and exercise, at least for 1 month. If at all it is not crossing too much, means it is not going to 160/100, or you are getting chest pain, or you are getting some giddiness like spells. So in that scenario, we can still manage for 1 month by the diet and exercise. If fail, then you have to take a medicine for the lifelong. And some situation you have to down titrate if your blood pressure are falling with either by the disease modification or by your lifestyle. So this is one of the important, means if whatever the in the medical science we say that the highest number of death whatever happening, the hypertension is one of the disease which is underlying most of the conditions. So it is from the kidney failure, heart attack, vision loss, stroke, heart failure, sexual dysfunction, everything here and there it is linked with the BP, blood pressure, and we can say uncontrolled blood pressure. Regarding cholesterol, so people are getting worried when they see the total cholesterol. So let me make the things clear. We never see the total cholesterol. See the LDL and HDL level. And LDL, HDL level has got a different, what you call, take. If you are having heart attack, it is totally different. Means already have, we say as a secondary prevention. And when you are not having heart attack, how to prevent, we call as a primary prevention. So the cutout is different and the threshold is different. Somebody, you will seeing 140 above, immediately the person is started on medicines. So the correct way of thing is, if your cholesterols are, you have to, first we have to check the background, means your family history, your disease history, if at all it is there, whether it is for secondary versus primary. If it's secondary, the thresholds are a bit less, means even up to 100 or 110, we can start it to prevent the future event. And how is the LDL and HDL? So HDL, higher the HDL, lower the chances of heart attack. Higher the LDL, more the chances of heart attack. So directly proportional versus inversely proportional. So bad cholesterol level, whatever we can say. Triglyceride is never in the part of this story. So triglyceride is, if it is 200, 300, 400, 500, not to worry, it is not directly linked with the heart disease. And when you are doing the total cholesterol, it will be the value in that one. People are yawning, I think we have to complete. Yes, sugar is an invitation for all diseases, in which heart is the first organ which get damaged here and there. And this is my domain also. Just so what I was saying, heartbeat, dil dhadakne do. So regarding the rhythm problems, what are the manifestations? So the important manifestation is the giddiness. Palpitation. So if you are getting palpitation, everybody can develop palpitation. If you are running, all of a sudden you will feel that your heart beating. So this is called provoked palpitation. If it is developing without any reason, if you are sitting, all of a sudden you started feeling your beat, but you should be mentally free, means there should not be any mental stress or thought process which is inciting is. Then it is called unprovoked palpitation. It is a electrical disease. If you are getting giddiness, if you are fainting, or sometimes people will say, all of a sudden I was having sweating and after that I feel very weak. So in perimenopausal time it happens, and sometime in the any person who is having rhythm problem, that also it can happen. So if you are getting this type of symptoms, it needs a electrophysiologist who can evaluate. Cardiology, there is a different domain we call as a interventional cardiology, who deals with regarding the blocks related issues, valve related issues, and the electrical problem for which we are seeing these symptoms, and for that there is a different way of evaluation. So giddiness syncope, and why it is important, because whenever the giddiness happens, most of the time people run to the neurologist. If somebody collapses, immediately they will say, okay, brain is having problem, let us do the CT, MRI. But it is mostly, a lot of time, it is a vascular problem. Vascular means the heartbeat, when it goes very fast or very slow, the brain doesn't get the circulation and you collapse. The time you are in the lying down position, the circulation immediately pick up and you get normal. And this is a transient episodes which happens. So somebody is falling more 1 or 2 times, third time he will lie up, we don't know. It may be some electrical problem which is ongoing. And sometimes the patient collapses. Usually the elderly patients who are going in the washroom, they fell down and they think that, okay, my leg has slipped, or he doesn't know because the problem was in the heart, the person has collapsed due to the rhythm problem. Mostly there are two type of rhythm, brady and tachy. So something has happened and the person has collapsed and somebody has screwed the hip joint because it was fractured. Patient has gone to the home. After 1 or 2 weeks, he has no more. The reason was the rhythm problem was not detected, not been evaluated, not been thought also. So anybody who is sustaining injury, either in the hip bone or the head injury, it should be think from we have to give a thought from the electrical angle also. Why he fell down? If he's saying that I don't know what has happened, then it needs. If he's saying I was going and I slipped, it's okay. Somebody has pushed me, I fell down, it's okay. But unprovoked fall is happening. It has to be seen in the light of heart electrical problem, and it need a totally different evaluation. So far all the diseases I have taught. So after teaching, or you can say sharing my experience, what I can say, ज्ञान तो आप लोगों के पास है ही, ज्ञान की किसी के पास कमी नहीं है, ज्ञान देने के लिए बहुत लोग हैं. विज्ञान की बात यही होती है कि सफरिंग तो आएगा, वी ऑल हैव टू सफर from one disease or other disease, or mental or physical, whatever you can say. Everybody means these are the truth where we are. And at the end, what you can say, old disease, one of the disease, or you can say one of the condition which we have to bear it, because all the systems start degenerating and we have to sustain it till the last battle. So suffering of heart start with the mind. And here the thing that we all have to understand, unless until if you are having hypertension, you are having diabetes, you are having heart attack, whatever is happening, we have to start working in the mind. Because this is your role to play. Here the doctor will not come. No doctor will give a time that you have to change this one, that one. He will say, oh, take this medicine, do this intervention, come after this one. And how many doctors will be having that association with you that you are my family person? I don't think. And nobody is having that much time in present fast life, and we should not expect. So resetting of the mind is very, very important. I think this movie everybody has seen. So whenever anything happens in your life, we have to reset ourselves. So if you are landed up in the ICU, or you have landed up with one diagnosis of heart attack, stroke, brain, we have to reset our mind also. And resetting is start with our thoughts. So I was asking the one question, and the answer is here. जातस्य हि ध्रुवो मृत्यु जन्म मृत्यु से तस्माद सोचते अर्हसि. I think this is the Bhagavad Gita 2nd chapter 27th verse, and it is for everybody who is sitting here. We have, whatever we are doing here, the time we have taken the birth, our death has been decided. This is written. But as the astrology say and everything we know right now, the time and seconds has been well decided. And this is becoming important for today, because everybody want to become Bhisma Pitama or this one. They don't want to die, and they don't want to accept that we have to die someday. So why not to take the suffering in a right way? Suffering means whatever the problem coming in not in a denial mode. We have to die, but whatever the habits we have discussed, what are the things in our hand, let us bear it, or we can say face it boldly. And here comes the importance of thought process. So resetting start with your thoughts. And this is one of the important study, and it has been done by a Japanese scientist, Masaru Emoto. So what he did, when you are giving a thought, how the water is evolving, the crystallization of the water which is taking place, it has been seen in the electron microscope. So you can see the person, if he's having compassion, thank you, wisdom, or if you are if you are having a thought process that I am going to kill you, you are fool. The different type of thoughts, and the water has been kept in this one. So if you are going and saying I am going to kill you, and you're saying thank you, what the crystallization is happening, it is going to differ. And you know or not, we all are around 70% water, including your brain, everything. So this is the way, if you are keeping everything in a good way, means what has happened to us, and we are keeping, okay, whatever is there, I am going to face it well. If I am going to curse, okay, why this disease has come to me, what wrong I have done it, why I should be selected for this disease. So this type of thoughts, when it comes, it gives a lot of suffering, and disease goes more faster. Your suffering goes more faster. Even the death line is already well marked, but your suffering goes. And that's why the resetting is very, very important. So it is not it is somebody who has already experimented and who has given all those information how thoughts changes the water, what we are having in our body, around 70% it is going to crystallize and makes the difference in your life. Even the emotion and the stress. So when the person is very much emotional and going on the more on the negative side, what happened that this is one of the study, your mindset change your disease progression also. Your immune system behave in a wrong way, or you can say not in an appropriate way to tackle the disease. So thought process, we know that we are having inflammation by saying the atherosclerosis has set in, means my family is having heart disease and I am also developing. So inflammation is going very faster if your emotions are not in the right thing. And these all things work on only thing, amygdala, what is called the animal brain's top centers. So that get so this is the frontier what we are facing, the vascular inflammation, and this vascular inflammation here and there, it is important reason. I think. Yeah, I think this has already been discussed. So these all are in our hand. Something like sleep habits, sedentary lifestyle, air pollution, wherever mask you can put. There is one saying regarding the second arrow. So what I was saying, everybody has to suffer someday or other day. So if somebody is developing heart attack, one arrow has to strike the person. That is well written and well, we have to buy our karmas, whatever you can say, we have to face it. But second arrow is in our hand. Our suffering starts from the second arrow. The first arrow is responsible for only 20%, but 80% come from the second arrow. The time that second arrow start means somebody is having like diagnosed with a heart disease, I am going to die. Why me only? Again, I have to heart attack. If somebody has put a stent, what the stent story, whether it is going to work or not, it is a international stent or a national stent, whatever. देसी स्टेंट दे दिया है, काम करेगा कि नहीं करेगा, डॉक्टर ने कितना पैसा बना लिया, all those nonsense things will start happening. But let us understand, the doctor has been decided by the God only. According to your life, according to your karmas, he will come in your life. Is it good or bad? It is decided by him also. So I feel that you have to submit to somebody and you have to select whatever in your capacity, wherever possible. So second arrow, don't shoot it. Wherever possible, one is there, bear it, try to handle it. And the second arrow is coming from these places, which all are. So if you can see, these are the channels from where you will be getting all these things, how they are going to hook you. So the Silicon Valley is the area from where we are getting a lot of information, we are getting emotionals. Our politician utilizes for their own benefit. They will give a lot of misguidance so that we should be divided, we should be having our own thought process, getting emotionally connected with them, we feel with them, and later on we find that we have been betrayed. So just a finger, what you call a thumbs up, was a master stroke, we can say, from the Silicon Valley. All of a sudden the Facebook has picked up like anything. And this is the story. So check your thoughts. Heart and brain are very well connected. And anything that makes you weak physically, intellectually, spiritually, reject as a poison. So this is the thing Swami Vivekananda told, and we should know that anybody who is trying to belittle you by your disease, try to judge you by your disease, it is not the right way. Whatever disease has come, we have to face it. We should not be in the denial mode. We should be in the harmony. Whatever is happened. Let us see what are the available options for me, what are the available doctor for me, and what are the things I can do from my side and the medicines. So these are the two persons who are well known for their performance. Regarding Sachin Tendu, I don't think. Regarding Big B, Amitabh Bachchan. So Big B is one of the most disciplined person, if you are knowing or not. Even at the age of he's reaching around 80 years. And in one of the interview, he told, everything can be taken from me, but my 1 hour of workout, nobody can take. That is my time with my body. I don't want to spare. And if you are knowing or not, he is suffering for almost 20 diseases. He's having half of the intestine over, means half of the intestine has been taken out. When he was having the coolie shooting at that time, that he did not, never say, but the cold drink, all those things has make the things, and that's why you never see that Big B will be coming for the cold drinks ads anytime. Most of the time he will not be there. He never tried to promote. And in that 1 hour, he said that I will be doing, and this is the way he has taken. He is having one disease we call as a masthenia gravis. If you are not taking the medicine, you will be on the ventilator. So his muscles are totally dependent on that medicine. So different diseases. The only thing, and even though he is an out performer, even with the new age actors or you can say celebrities, nobody is able to cross him in his performance. And that's why I am saying, whatever disease comes, still you are having way to fight it. He can fight with 20 diseases at the age of 20, performing and outperforming with the persons who are of 30 year, 40 year younger to them. And what is making a difference? One is discipline and the second is mindset. I can do it. We all are having given all those capacity. So motivation get you going, but the discipline keep you growing. So we all have to keep wherever possible in our lifestyle. And you are saying what are the things you are going to make you happy, or you can say anti-inflammatory, means or whatever you go anywhere, the discussion will be inflammation. But what is inflammation? Inflammation is something smoldering in your vessels, smoldering in the body. Sometimes it converts into cancer, sometimes it converts into blocks. So these are the way in which it is going. So what is anti-inflammatory? Exercise, gadget-free, heal by the nature, sleep, and touch from the loved one. If anything is lacking in your life, certainly it is going to give some sort of inflammation, or your inflammation is not going to come down. And I think all the things are well possible in present scenario. So wherever possible, try to add the anti-inflammatory methods to. And regarding whatever the final message, if at all I have to give, so the answer for anything means how much we should do it. So yukta har viharasya yukta karma kese yukta swapna bodhasya yoga bhavati. I think whatever we are doing, if we are going to the extreme of anything, it is not going to, either eating, living, or sleeping, whatever, it has to be balanced, well balanced. So balance of our habits is going to make us healthy. And whatever I am teaching, or I can not, I should say teaching, I should say sharing with you people, I practice all those things. Because if I am not practicing, my words is not going to affect you. So this is my profile. So I am a marathoner also. I have run for 42 kilometers in 4 hours 57 minutes in 2021. And I run as well almost around 7 to 8 kilometers every day, most of the day, 6 to 7 days. And this is the 4-year record, 4,275 kilometers I have run. And on top, I have written 2 books. One totally meant for the doctors who are cardiologists, not for the just general physician. Cardiology who has completed for them, who want to know about the electrophysiology, what I was discussing, because this is a domain where very less cardiologists are there. If at all you are going to count all over India, it may be maximum 100 doctors for 1.4 billion Indians. If you are going to calculate the cardiologist, it may be around 10,000. So we are very few doctors who, and you are fortunate that in Hyderabad maybe 5 or 6 electrophysiologists are there. But all over India we are on top. If you are going to count, it is not more than 100. So, and the diseases are at par with them. Means the cardiological, means interventional work and the electrophysiological work, both are almost same. And why I have to bring this heartbeat foundation, the reason is the rhythm problem is under-detected, under-treated, and sometimes a lot of patients die before they are being diagnosed. So awareness is important. So I have written a book for the doctors and one for the any person who want to know regarding the heart diseases. If at all heart disease is there, immediately the person start thinking, Googling, multiple opinion, multiple interventions sometime, and finally they'll end up in the problem. So I thought one of my friend, he was the person who motivated me because I was running a YouTube channel. He was saying, you are talking too much on the things. If till you are there, you can talk now. When you are not there, how you are going to keep all those information? Then I thought he's right. He's no more right now. He's a cardiac patient. We both were classmates. He developed heart attack after that in the corona time, and later on multiple treatment has been done at hospitals. And if you are in a family where we can say in-laws side and parent side, there is a fight is happening in the families. One is saying we should go for the bypass. One is saying no, we are having a treatment where we call as a without bypass we can open the vessels. And I was saying, don't waste your time. This is not the disease which we are going to chase by doing the bypass, because muscles are already gone. Your muscles, if at all it is there, that's why I was saying, go by the thought process, lifestyle, all those things. And he went for stenting. Later on, somebody told for bypass, and he developed some clot, and then finally he's come in the hospital. So that was a very bad ending for him, no doubt, but nobody should suffer like that. I tried my best to document all those things that everybody should know in the public domain. And that's why I have written this book by Heart Harmony. The meaning is that if at all your heart has been touched by the disease, you should harmonize with it, how to tackle it, how to sail your boat when you are knowing that now you have been diagnosed with the disease. And this is available in Amazon also. So what is the answer now? So answer is this one. What sir was saying, I think he was correct. Partially, we all have been decided. Our day has been decided. We should not worry for that day. Today or tomorrow, whatever tomorrow you are going to label it, it is well written. Nobody is going to change. No doctor is going to change. Don't expect too much with the science also. Science is only meant to reduce somewhat your suffering. If you are having pain, we will relieve you. Then and there we will relieve you. But if you want a longer life, then you have to pray to the God, number one, to pray to the right doctor. Right doctor means he is going to allot a doctor, you know or not. When you are going to develop a heart attack, if you are in the Himalayan area, you will not get a doctor there. So whoever is there coming, he is your doctor. Who has allotted it? The time has been allotted in that place was the heart attack. You have developed, somebody has to solve it. So it is the scenario, and the scenario has been done by the already, means that's why Jatasya hi dhruvo mrityu, means the time you have taken the birth, the death has been well decided. And birth has been, the time you are taking birth, death has been well decided. So why we should be worrying? And this is the worry what I face. 23-year boy, sometime 30-year-old boy, sir, he has died. My friend in front of me died. I want to get a full body checkup. Nothing should be left behind. He come with sometime a lot of reports. And sometime I find him and I feel how to convince him that it is not the way medical science will give you any answer. I am around 50 years. And at 50 years, I can say I have not gone any evaluation. It will be surprising to know that just I work on myself. Process should be very clear. If any patient is sitting, what is my responsibility? What is the best I can do for him? I deliver those things. And by the God grace, whatever I started my journey with a very humble background. My father was an Indian Air Force personnel. And from there I started, and I have reached to this level that I am practicing in Hyderabad, where I was not able to step sometime. I was thinking, such a big city, where I am going to stay and how I am going to manage. And today I am working as a clinical director in one of the top corporate hospital, and I am happy there. Happy there means whatever I want to deliver so far, I am able to do. Yes, corporate is having a different lifestyle, different way of thing. But even in that scenario, I am able to deliver whatever in my domain as a doctor, as an interventionist, as a Indian nation, because I would have enjoyed my good life in US or European country. But since I have been brought from the taxpayer money, I have completed my MBBS from the government seat. It is my responsibility that I should deliver in my country, and I am proud that I am able to deliver, starting my career from Rajmundry, then Nellore, then Hyderabad, and before that it was in the West Bengal and Banaras, wherever I have practiced. So that is my way of living, and that's why I'm saying, don't worry for the death. Death is certain for everybody. Just enjoy the life, whatever way in there to deliver your services, because at this time, as a father, as a brother, as a friend, we have to deliver. And if you are perfectly doing that thing, that was because swast means what you are and you are delivering, that is called health. If you are a doctor and if I am doing a business, frankly, it is not correct, because I am diversing, because I am a doctor. As a doctor, I should make the business for hospital, there's a different thing. But only the business should be my part of practice, then certainly it is not swast. Swast means I am not a doctor. I can be a doctor plus businessman. That is a different. Business means I am running the business. Hospital has infrastructure for the infrastructure. I am bringing the patient. I am diagnosing and I am treating it. That is okay. But I am over-diagnosing to make a business big. It is business. It is not a health practice. So here the things are diverging, and the reason is, we all know, the reason is not the doctors. The reason is the medical system or the education system has been too much capitalized. And if you go in the depth of this one, you will find here and there the politicians and the nexus here and there. It is linked. Whatever the big hospitals are there, who is owning it? It is not me or you or the common person. It is the whole hospital system in the Hyderabad is nowadays run by US people. What you are going to expect in that? They are going to do the service? No. We have to do some service, no doubt, but at the top, the business should be the line. And that's why the top management, we call say non-medicos, have dominated the things. They need only ROI. My skills are not important for them. My degrees are not important. How much patient I am seeing, how much TMT I am doing and converting into angiography, that is my skill. If I am fail in that, I am not a good doctor in their book. But yes, I want to be good in my book. I enjoy it. And so far, I am enjoying it. Thank you so much. And this is the last slide. So cardiac arrest and heart attack, what difference? It is a like plumbing and electrical job. So plumbing job, you need a plumber, what we call as an interventional cardiologist. Whenever block is there, they will open it. And for electrical problem, you have to call the electrician, we call as electrophysiologist. So they will check where the electrical problem is happening. There is a ways and means, and there is investigation for that. And by that, we can detect it. This is a YouTube channel which I have started just for the public domain, so that they should be knowing what heart diseases are, how to identify the heart diseases. And most of the things I have kept, whatever I have talking, most of the things is well available on the YouTube. It is mostly in the Hindi, sometime in English. And with my whatever the bad or good Telugu I have tried, somewhere I am successful in that also I have tried it. And this is a good movie, and I always try to quote. Sorry. So I think watching this movie, everybody has enjoyed this movie. 12th Fail. I think if you have not seen it, everybody should see this movie. This is a very... So this is a story about a very, if you have not seen, I will just brief it, that a story of a person by name Manoj who has become IAS officer. And he was from a very, very remote place where he don't know what is IAS, but he has reached to that level. So in that school, everybody was cheating, and cheating was a norm in the school. So he was not knowing that cheating is wrong. And this police officer who he showed it, so he told, तुमको cheating छोड़नी होगी. Then you will become IAS. वो बोलता है मैं आपके जैसा बनना चाहता हूँ. I want to become like you, like a police officer, like of your grade and your attire, that even the minister is calling you, say, okay, I will not take the money, all are failed. And that year everybody failed. But when he was inspired, he wanted to become like that, तो उसने सिर्फ एक ही आंसर बोला था, cheating मत करो. Here, whatever we are sitting, we know here and there we are cheating for one reason or other reason. It may be in our lifestyle, it may be on a habit, it may be in our relationship, anywhere. Wherever you are cheating, certainly it will backfire, it will reduce your efficiency. It will invite different related physical, mental, all those health. And finally, if at all you are very much successful in cheating, certainly those things will be counted. Your second birth will be certainly going to settle it. So be ready for that, and we will not be spared, because I was going through some of book in that it was saying if you are doing some small cheating, you will punish in this birth. If you have make a quintals, then you have to take one more birth and you have to do it. So do cheating, but less as much possible, wherever possible. Okay, thank you. So these are the numbers if you want to reach to me, and these are the YouTube things which I was saying. Okay, thank you.
Thank you so much, Dr. Ashutosh. And I must say, you have not only made us aware and guided us for a healthy heart, you have also won our hearts, right?
Thank you, thank you.
There are three things. He busted many myths. He told what he can do, what he can't do, and he also laid the system bare in front of us, what is happening. And very humbly, he has shared all his knowledge. Thank you so much, Doctor.
Thank
It
you.
was an amazing session. They must be yawning because of the fatigue, but I can assure each one of them was very much aware and attentive during the session.
Yeah.
So we would also like to tell you that you can see the passion that he has for creating the awareness. He is also the founder of the Heartbeat Foundation. It's a not-for-profit charity foundation which is having one aim to create awareness about heart diseases and how people can, proactively, prevent them. So we also have Sister Pragya with us, who is the Secretary of Heartbeat Foundation. We would also like to invite her on stage, and Sister Vasanta, and from the entire Sunday Talk family, we would like to say a few words as our gratitude.
I'll not take much time. First of all, on behalf of Heartbeat Foundation, I want to thank Brahma Kumari's organization. I want to thank all of you. On a Sunday evening, you are here because, yes, Heartbeat Foundation is committed to spread knowledge about heart rhythm problems, to give you a hand, helping hand when you are suffering. So you can reach us at heartbeatfoundation.org. And I heartily thank all of you. I heartily thank Brahma Kumaris for this opportunity, and I'm looking forward for another opportunity very soon. Thank you so much.
To get the questions from the audience. Yeah. No, it is open. Yeah. Oh, I sorry.
He is open to consultations whenever you want.
Yeah, that would be good because it's half past.
Yeah.
Are you available at this organization in Pupalguda, and what are your timings?
Yeah.
You can email us, you can email your queries, and you can visit the website as well.
So this 9963299122 is my number only. But better you put a WhatsApp in this one. I will,
Scan the code
and all the details will be there in
all
that
the
one.
details about the Heartbeat organization.
We want a contribution from your side, not as a financial contribution. We want that people should know about this thing and they should spread. Whatever information I have shared with you, I want at least some gist you can share with your friendship circle so that they can be benefited with that. We can't be able to reach everybody. I have tried through my YouTube channel. I won around 6,000 subscribers still there in that, and book also written. But it should be what you call public awareness, that they have to know what is right and wrong, because information what is spreading in the media as well as in the hospital marketing, it is not going to resolve our health issues. We have to be aware, we have to take action, and action has to come from inside why they are doing it. So we are only going to reduce our suffering. Suffering will reduce when your mind is clear and your thoughts are sound in the right directions. Thank you.
Dr. Sab, as you said, 2 arrows. So, so this is what that second arrow is actually. The suffering is our own choice. So, thank you once again, Dr. Sab and Pragya ji also. for being here. It was so accidental meeting with Dr. Saab as well as having this talk, because there is a conference in Mount Abu, Mind Body Medicine conference for doctors exclusively. A small group of doctors from across the country, they will be there. So we were trying to get him for that conference actually. That was just this week only. And then I said, why don't you come to Shanti Sarovar before you go there? And before you attend for that spiritual session, you can give your physical, health session also. So that is how he immediately said yes for this Sunday itself. And he is here and he is spending his time and giving the knowledge, as it is not just heart is heart. When we were talking with him when he entered in the campus, because he came hardly here once for Sister Shivani's talk last year and then now. So when we were meeting, then we also came to know about his specialization, which is electrophysiology. Because many of us, I'm sure no one here knows about this specialization, because there is two different specializations in cardiology also. Then we said, why don't you talk all these things also, because we have to know where we have to go when there is problem. So as he mentioned many shlokas from Bhagavad Gita also. So everything, and of course at the end he mentioned about karma, how it will come back, you cannot cheat. So that is where at the core of Brahma Kumaris also we all teach, because everything, whatever I have done, if it is hidden thing also, if I have done in a hidden way also, there is, it is said Chitra Gupta. गुप्त रीति से चित्र निकालता रहता है ना, हाँ, चित्रगुप्त वही है ना. There is no one which is sitting there and giving you punishment or reward, but our own karmas will pay us back, whether it is reward or punishment. So I have to be aware of my karmas, my thoughts, my words, my actions, everything, because that is what I am going to get back. So this is what, as a core of Brahma Kumaris, we teach and learn how we can change our own selves, so that the body also will be in our control, because as we train our mind, that is how the body also function, है ना. बहुत बार आप देखे दीदी को, कुलदीप दीदी को, such a big phase she went through, and now she is in a different stage, because the thoughts, she always says, आपने भी सुना होगा, मैं कैंसर को कैंसिल कर दिया मेरे माइंड से. हाउ गुड दैट फ्रेज इज, कैंसर को कैंसिल कर दिया, इधर कैंसिल कर दिया तो शरीर भी कैंसिल हो गया वो कैंसर का. सो हाउ द माइंड प्लेज अ बिग रोल, इम्पोर्टेंट रोल टू कीप आवर बॉडी ऑल्सो हेल्दी. So that is what Brahma Kumaris is teaching, and you all are welcome to learn Raj Yoga meditation, and which gives a lot of energy and strength to deal with the problems outside as well as problems in the body also, because it's a harmonious thing with lot of different approaches, lot of different aspects of life. तो ब्रह्मा कुमारीज का भी मैं भाई साहब को बता रही थी शुरुआत में कि we have a big program of this same heart program, CAD regression program, coronary artery disease regression program, which goes on in Mount Abu. Every year 3-4 batches goes on, which means this was a big research with 3 different organizations. One is Brahma Kumaris and DRDO and DPAS, Defense Institute of Physiology and Allied Sciences. So, and DRDO. So when he was Abdul Kalam ji was heading DRDO, then when he visited Mount Abu, he came to know about Brahma Kumaris and meditation, and he practiced, and he said, which is very much relevant for this time, and why don't we collaboratively do a research how we can regress heart diseases through 3-dimensional healthcare. So one is, as Dr. Saab mentioned, about healthy diet as well as healthy habits also is needed. So 3-dimensional healthcare, of course, you have to take care of your medicine and all those things, But more than that, your mind to be healthy, meditation is needed, good diet is also needed, and then exercise, as he mentioned, lot of emphasis on exercise. So these three-dimensional healthcare, and the patients goes there and they stay there for 8 long days, along with, we call them dilwalas, right? And Dilwala and one attendant also will be there, and they will stay there and they experience the program, and after coming back also they will practice. So means exactly, there is lot of research went on 8 long years, and then thousands of means lakhs of patients are taking benefit. And of course it is not after coming we will take care of the heart, but it is before that, how healthy I am, how proactive I am to do anything to keep myself healthy. So it is so nice that you collaborated with Brahma Kumaris now, and you can extend your services through this community also. They will reach out to many people and inform the Heartbeat Foundation, as well as along with Heartbeat Foundation, you can take care of your own mind through meditation also. So we thank you from bottom of our hearts for spending this precious time and giving a lot of information, as well as with your experience. So thank you. And from Brahma Kumaris, we want to extend some compliments to you.
So from all of us to Dr. Ashutosh ji, we like to thank you, and I hope you can keep visiting us here. Thank you so much. Godly greetings and godly gift from Shanti Sarovar to Sister Pragya. So with this, we come to the end of our today's Sunday evening talk. I hope you enjoyed it as much as we were enjoying. So this was a very healthy session. Yes. So next Sunday would be special. It would be Raksha Bandhan celebration with all of you.